In this week's episode of Weathering Parenthood, I'm sitting down with Dr. Jared Friedman. Dr. Friedman is a pediatric concierge doctor who is really passionate about helping families find the right care.
So I came up with this model of, concierge, but really it's pediatric emergency medicine concierge. And I'm bringing the emergency department to you. I'm bringing my skills to you.
We talk a lot about his background and what led him to become a concierge pediatrician, and also about the incredible work that he does all around the world. Dr. Jared Friedman, thanks for being here with us today.
Of course, thank you for having me. It's a true honor and pleasure.
So I'm honored. I'm going to ask the same two questions I ask everybody. Where are you from and how many kids do you have?
Awesome. Great question. So I am actually from New Jersey, but spent a lot of time in New York and Philadelphia, Washington, D.C. I'm a Northeasterner, and I have 3 kids. I have a 9-year-old, a 6-year-old, and a 2-year-old.
When did you guys move to Florida?
So I would say we are the pioneers. We moved before COVID in 2017, and we got a great warm hug and welcome from Hurricane Irma.
Yes.
It was fun times.
What was that like? Was that like terrifying for you?
Honestly, we're used to snowstorms. I've helped out in a lot of like hurricanes. We actually lived through Hurricane Sandy up in New York. So I didn't really know what to expect, but a Hurricane 5 theoretically hitting Miami is concerning. We had 1 kid at the time. We had some pets, my wife. I ended up staying in the hospital and sleeping there for about 4 days while my wife escaped to Atlanta, Georgia with the rest of South Florida. So it wasn't terrifying, but it was definitely a rude awakening and a nice welcome to South Florida.
That is the perfect welcome to come down here. I do like that you call yourself a pioneer too. Before, it was before the influx of all the COVID people.
Yeah, it was definitely, interesting times. I gave up a couple of great jobs up north, and when I came down here, people said, "Are you sure? Like you're young. Like, what are you doing? You're not, are you retiring? But it was a great experience. And, living through COVID, living through just the whole experience has been really amazing. It's one of the best decisions we made together. So definitely no regrets.
We'll get into some of the COVID stuff, but what made you originally want to move to Florida?
Yeah. So I was looking for, an opportunity to just basically break free, make a name for myself. And I always tell the story, and it's true. So my wife, who is a nurse, but really she's my better half, she basically said, she's like, Jared, what do you want on your tombstone? I said, I'm sorry, what? Like, do I need to check my life insurance plan again? Like, what's going on? She's like, no, Jared, what do you want on your tombstone? Do you want to say you went to and worked at the 2nd or 3rd best, children's hospital in the country? Do you want to, say that you worked your way up and became medical director? Do you want to say, you did research and traveled around the world and was working all the time? Or do you want to say, you went to South Florida, you had quality of life, you're able to make a name for yourself, you're able to, be at every child's, soccer game or dance recital? Well, what is your choice? What is important to you? And after she said that, it was a no-brainer. So that's how we moved down here. And then she said one other question. If we're moving to Florida, we are only going to be living on the beach. So that's why we are living in Miami, on Miami Beach. And again, she was right. So I hate to say that in public. Now it's really in public, but she's definitely right.
It is a really great place to live. It's a year-round vacation down here.
Yes, no, absolutely. People vacation where we live. So I completely agree with you, Lauren.
I agree with that statement too. So when you were young, did you always know that you wanted to be a doctor? Always wanted to be a pediatrician? What kind of made you choose that career path?
Yeah, so I think I always wanted to be a doctor. Or at least, that's what my parents told me. My older sisters, I'm the youngest and the only son. It was either being a doctor or being a lawyer, because I used to always, find ways of getting out of chores, or, finding ways of finagling myself out of certain things that I had to do with my siblings or whatnot. So it's really coming down to a doctor or a lawyer. And my mom still to this day says that I was, is, and probably always will be a very caring, considerate type of person. So she really thought that, medicine was for me. And I wasn't sure what I wanted to do in medicine because obviously the world is your oyster in a way. But I didn't actually want to do pediatrics initially. I thought I would be a surgeon. I like challenges. I like to do things like procedural with my hands, etc. I also like to do many different things at once. So initially, I thought I'd be a surgeon. Then I had to wake up very early in the morning, 4:30 in the or so every morning, and I said, "Yeah, I'm a night owl, so let's cross that off the list." So then I went into emergency medicine, or at least my rotations in emergency medicine, and then I realized that kids or pediatrics are really what I devote myself to and what I get along better with. And maybe that's because I'm a kid at heart and whatnot. But I then went into pediatric emergency medicine, and best decision ever. I love it. Fast paced, procedural. I could be a kid. I can, tell jokes and, do different things on the floor and use props, laugh all the time. And in my way, it's very fulfilling just knowing that kids, first of all, having your own kids is a different ballgame when you're a doctor and especially as a pediatrician. But they have their whole life ahead of them. And it's in a way, if you can make a lasting impact on them, on the family, it's really priceless.
That's so sweet. I love that. So let's talk about school, residency, med school. Where did you go to school to train for all of this?
Yeah. So I started out at the University of Pennsylvania for undergrad. And then I decided to double major and minor. And I didn't really have a chance to study abroad. So I opted to choose a medical school abroad. So I went to Tel Aviv University, which actually has a partnership with New York State instead of some places in New York and Boston and in California, much to my parents' dismay. But best decision of my life as well for a couple of reasons. I studied abroad. I learned about a different healthcare system outside the United States. I met my wife, of course. And then I came back to do my residency, which is 3 years after medical school. I did that in New York City. And then I did an additional 3 years in pediatric emergency medicine. That's a fellowship. And then I combined that with a little bit of extra training in pediatric emergency medicine trauma. After that, I was married, and my wife said, if you do one more year of training, like this is going to be it for us. So I stopped there. And I have been doing this for the last 10 years outside of training. But really, if you include training, that is an additional 10 to 14 years on top of the almost 10 years. So it's been a long road. And, while my friends are either earning money or living the life or traveling the world, I was studying, I was learning, I was, not getting enough sun. But again, best decision. And I would not change anything about that.
And that's why you moved to Florida, because you can study outside now.
Totally, totally. Now I just have to put extra sunscreen. So public service announcement, sunscreen, SPF 30 and above. Learn how to swim. Very, very, very important. We are actually the number one place for drownings, especially in kids 1 to 3 years of age. But, yeah. So I love it. I'm down here. I can study, I can play, I can work inside, outside, and just be happy. So yeah, come down here. Just don't come down to where I live because the traffic is already unbearable.
It's so bad down here. Oh my goodness, is the traffic crazy?
Totally.
Pick a new part of the state, everybody. So your wife said, stop, enough with all the training. If you could keep training endlessly, what else would you want to go and learn?
Probably not not related to medicine, but maybe connected actually. I would like to learn just different languages. There's always a question people ask, like, what is your superpower that you would want to have? Your strength, your money, your health, etc. I would say actually just learning and understanding and being able to speak every language out there, because the human spirit, the human a connection is really unbeatable. And especially in medicine, I think that understanding someone's culture, understanding someone's ability to communicate with one another is so powerful and extremely helpful in the medical realm. So that's one thing I would do is, just travel around the world, learn about different customs, religions, ethnicities, cultures, and learn their language and have them learn mine so we could connect on a different level.
That's really cool. Let's kind of spring off of that. So we've spoken before we did this interview, and you have in fact traveled a lot. You've done a lot of volunteer work. Talk about some of the places you've been, the people you've met, some of that work that you were doing.
Yeah, it's just a humbling experience. I just want to start out by saying that it really started when I was in residency. So this is going back. Wow, now I'm dating myself. Sorry. Um, 16 years ago, when I ended up doing a month, or no, 3 weeks, I believe, in the Dominican Republic. And we were in a little area called La Romana. If you're not familiar with that, it's right outside of Casa de Campo, which is actually one of the wealthiest areas or places or resorts in the world. But you have the complete, dichotomy of that juxtaposed next to a very poor area. And there were these little bateys. These little bateys are actually their Haitian families who escaped because it's on Dominica. It's the same island, but went over the border from Haiti into the Dominican Republic for a better life. And they live in these little, I guess, villages, if you will, where there's no medical care at all. So when we went out there, we were probably the first and only doctor they saw in 1 to 2 to maybe even 3 years. Um, I mean, we taught them about the importance of fresh running water. We taught them about, oral hygiene and the importance of washing your hands. We taught them how to breastfeed. I mean, which is perhaps the cheapest, the best nutrition out there. So, and the kids there, honestly, it was absurd. Like there was an old tire from a car that they were playing, and they played for hours, and it was just really amazing, what they did, and just the importance of being happy. And we gave them band-aids, we gave them stickers, we gave them anything we had to just change their attitude on life. And it was really eye-opening, but really we were making such a difference. So I think that really opened my eyes to the world out there of global medicine, and really the importance of providing care to other people in different countries, and not just first world countries. I subsequently helped out in the earthquake in Haiti. I was in Israel and different areas where there were terrorist attacks. Here, just locally, if you want to talk about that, Surfside building collapse, again, in my neck of the woods, in my neighborhood. And, just being a part of that was incredible as well. I was also supposed to go to the Moldova and actually Ukraine when the Russian Ukrainian war opened. My kids actually grabbed onto my legs saying, "Don't go, don't go, don't go." So I ended up not going. But what I was doing telemedicine with some of the doctors there from a pediatric ER perspective. So I've really tried to just open my eyes, expand my horizons, help those who are less fortunate, but also just don't have the ability or access to that. And one of my big goals is in life, not only being a role model as a parent, but also showing my kids that, outside of cars and the aesthetics of the United States and South Florida specifically, that really there's so much that they can do in this world, and bring them on health missions with myself and my wife. So that's my next step in life.
That's really cool. Would they are they like open to coming with you? Like if I was
Yeah.
feel like if I was like 8, I'd be like, where are we going next? Like, let's go.
Yeah, I would say my 2-year-old probably doesn't understand. If you give him a lollipop, I think he'll go anywhere with me. But the other two really, they just have the biggest hearts. And I owe that to my wife. I owe that to the work I'm doing. So they're the ones that, whether I'm praying in synagogue or I'm in a grocery store, they're like Abba, which is daddy in Hebrew, but they're like, come, someone needs help, come, and they grab my small medical bag, and they bring me to them, and they're always just warm and welcoming and kind, and they sit with them, these kids or even adults, and just talk to them. So yeah, I think they like the challenge, they like the experience, and they like change. So yeah, hopefully they'll enjoy it. If not, I think it's at the minimum a good lesson for them, just to know that there's other kids out there, with less than they have or more than they have, and that's okay, and that we can all still play the same games, speak the same language, eat the same foods. So that I think is priceless.
That's awesome that they get to kind of see maybe and experience things that other kids wouldn't because of what it is that you're doing.
Absolutely.
Plus the added benefit of just traveling the world, like that'd be awesome.
Uh,
I
yeah.
would, I would also agree with your wife and say, stop studying. Let's go travel somewhere now. Like I would have said the same thing to you. um, do you have a favorite moment from when you've traveled? Is there a specific memory, something that just kind of stands out and from all of the travel that you've been able to do?
Wow. I haven't thought about this question in a long time. Thanks for putting me on the spot.
You're welcome.
Um,
We can edit out the silence if you need a few seconds to think.
no, I'll just make it up on the spot. It's called great.
Great.
Um, I don't really have one specific moment, and I'm being totally frank with you because I think at the end of the day, each of the moments we live, each of the experiences we have, each of the people we meet, the things we do really make us who we are. And I think there's no specific moment out there with traveling, but actually, come to think of it, no, actually, I do have one. And it's not with me traveling, it's me actually being on as an interviewee. I do interviews for a university and medical school and residency and fellowship as well. I remember, and this is sort of off topic, and I apologize, but I was interviewing someone for the University of Pennsylvania, and they were in their home in El Salvador. And one of the questions was, I said, look around your room, look around your house. What is the one important sentimental thing that you have, and why? And she literally, without hesitation, turned back and she picked up a rock. And she's like, and I said, what is that? And she's like, to everyone, it may seem like a rock, but to me, it's my home. It's my family. It's the experiences. It's my childhood. And that rock signifies everything of where I've traveled, where I've been, and ultimately where I'm going to go. So I take that story with me in that when I travel, whether with my kids or with, myself on a mission or whatnot, I think about that rock actually. And I think, what can I bring back from these trips to provide that sentimental value? And one time I brought back like a shot glass full of sand. And my kids were like, what is this? What are you doing? Or another, it was like, just my ticket stub from a little play that I went to. So I don't have something specific per se, but I would say is I believe in experiences. I believe in making memories, and I believe in just the physicality and the tangibility is nothing compared to what we really live and breathe and experience, and those are the memories. So that rock during my interview was the one thing that helps me in every place I go to.
That's very special. Yeah, they're probably like, where's the toy? Like, I want a cool present, not just a bunch of sand.
Yeah.
But as they grow up, you're teaching them like the real value of experiencing some of the things that you've been able to experience.
Yeah, I try. I'm not perfect, obviously, and definitely talk to my wife about that. She can give you a whole laundry list. But I think what we're trying to do as a team is, bring up kids, be good role models. And at the end of the day, it doesn't matter how much money you have or how much money you don't have, what car you drive, where you live, what clothes you're wearing. It matters is being a good person, being a good human being. And just making a difference in other people's lives. So and just being together as a family, having your health. And I think that's one of the other draws to why I went into medicine is, the importance and value of health.
I love that. So I want to talk about, still on the same subject of you being a doctor. People are listening, being like, he's a doctor. How does he travel so much? So you are a concierge, with a proper term, doctor. So you're not in a typical office setting. Did you always want to do that? Or did you once work in an office and then decide to stop? What kind of led you on that career path?
Yeah, so it's an interesting pathway. So as you heard from before, I'm pediatric emergency medicine trained. So my job, or my sort of home base, if you will, is the children's hospital, and it's the emergency department in the children's hospital. So it's shift work. whether it's 8 or 10 or 12-hour shifts, you're on, you're off, you're off. And that's what I signed up for. Now I can have time with my family. But then obviously being here in Florida before COVID brought tons and tons and tons of families to come from, whether it's the Northeast, whether it's the West Coast, whether it's, from Canada, from Europe, wherever. And they came to a place where they can enjoy and have quality of life, live outside, breathe a little bit more, if you will. So what COVID did to South Florida is just exploded, right? Tons and tons of families came down here. Now, with that, there's always, two questions that families ask from a health perspective. One is, who is a good OBGYN for my wife, or, for me, if you're a woman. The other is, who is a good pediatrician? And both of those questions I got, because again, I've been here for, before COVID for almost about 10 years. And I said, honestly, the medical care here in South Florida leaves a lot to be desired. And this was, again, during COVID, 2020, 2021, even up to 2022. And they said, what are you talking about? I said, guys, where you're coming from, that's the Mecca. These huge academic institutions, evidence-based medicine, these doctors that know what they're doing, or presume know what they're doing, and have access to everything. And a lot of these families were high net worth, high profile families that came down here. And they heard about me through word of mouth. And I did a couple house calls for them, for their kids. I take care of, as I said, 21 and under. And it just so happened, they said, Jared, you're exactly what I'm looking for. I want you to be my kid's pediatrician. And I said, wow, that's really flattering. Thank you so much. I'm honored. But I'm a pediatric emergency medicine doctor. Of course, I trained in pediatrics. Of course, I can do well visits. I can do vaccines. But I also do urgent care. I also do emergency care. And they said, Jared, you're exactly what I want. You're that Northeast, sassiness with that education. And you have the education and training that you can do all of that, plus whether it's an emergency or not. So I said, nah, I'm good. After a while, a couple more people said, or a couple more families said, Jared, you're the guy I want. So I started thinking, and I, spoke with my wife. I spoke with a couple of my mentors, up north, and they said, Jared, do concierge. And concierge back then, now mind you, this is during COVID, it was not really a big thing. COVID had really brought out what the model of concierge is, in my opinion. So during COVID, if you were not medical yourself, or you didn't have any connections, you unfortunately did not get the best care, or you're not allowed, to have sort of a liaison, if you will, to help guide you and provide details. So COVID really brought out the idea of concierge, whether they're on their yachts, their private planes, whether they're in the parking lot, in a store, wherever it is, wherever you're comfortable, why don't I just come to you? And so I came up with this model of, concierge, but really it's pediatric emergency medicine concierge. And I'm bringing the emergency department to you. I'm bringing my skills to you, whether it's by phone, whether it's in person, whether it's doing testing procedures,
can you hear me?
It's, doing anything I do. I can basically bring 99% of what you can get in the pediatric ER to your home. So that's really what I started. So I don't have a physical office. I don't have a brick and mortar. It's all, in the comfort of the family's,
I don't think you can hear me.
Location, wherever they would like. And that's what I sort of took on, and it just expanded. And in fact, if you think about it, I'm still doing shifts in the ER. I've definitely significantly went down on that to provide more time for concierge. But I'm, still in the ER. I'm one of the clinical professors there. I teach the med students, the residents, the attendings. I teach in medical schools as well. So I gain access to the system. I keep up with my skills, with the connections, whether it's a pediatrician or a pediatric subspecialist. And what I've gathered is really a global network. So a lot of my families, like I said, moved down here, but I have relationships with doctors all over the country and all over the world in many of these large cities and countries. And I built that over the last 10 years. And I just think it's amazing that I can provide care no matter where my families are. And
thunderstorms that are hanging out mostly off the
As a meteorologist, I can't always control the weather. And as parents, we can't always control our kids, but we can make sure our outfits aren't a total disaster. That's why I'm excited to partner with Mario Pucci, South Florida's destination for timeless, stylish clothing that fits every chapter of life. They can get you out of the leggings and out of the house. Whether you're headed into the office, out to dinner, or to the carpool pickup line, Mario Pucci has you covered. Plus, when you look great, parenting somehow feels easier. Visit Mario Pucci in Regency Park, Boca Raton today.
Well, obviously, with all of the travel that you're able to do, you're not in a typical office setting. You are a concierge pediatrician. Was that always something that you wanted to do? Was that like a career path you made after being in an office setting? What kind of led you down that road?
Yeah, so it's a long story, but I'm happy to share everything with you guys. So as you guys know, through residency in pediatrics and pediatric emergency medicine fellowship, I am a pediatric ER doctor. So my job when I moved down here about 10 years ago was in a children's emergency department. So I work in a large children's hospital in the ER only, where I have either 8 or 10 or 12-hour shifts. And that gives me time to travel, it gives me time to be with family, it gives me time to, you know, do my shifts. But what happened was COVID, right? So I moved in before COVID, right? We talk about I was a pioneer, but I moved in before COVID. And when COVID happened, 2020, 2021, even 2022, a lot of families tried to get that quality of life that I was already living. So a lot of them moved down to South Florida. Whether they were from New York, Boston, DC, Chicago, the West Coast, even Montreal, Toronto, even places in Europe. Families moved down to South Florida for that comfort, that sun, if you will, that freedom, a fresh breath of air. And what happened was there's two questions that they really ask from a medical perspective when you come down here. It's who's the best OBGYN if you're planning on, having kids and building a family, or two, who's the best pediatrician for your kids or, future kids. And my answer was always the same back then. It was good luck with that. Go back where you came from. The care here is not great. Do we have hospitals? Sure. Do we have doctors? Sure. But the quality of care, the academics, the evidence-based medicine really wasn't being practiced as much as it should have been, or as much as I learned and was, clinically up north when I practiced and when I trained. So COVID brought down these families, and through word of mouth, because that's, I don't advertise or market, but through word of mouth, people heard about me and they said, Jared, great. Can you come and do a house call? I said, sure. Like, no worries. That's fine. So I did a house call, and afterwards, 3 families basically said, Jared, I want you. I want you as my kid's doctor. I love you. I said, please tell my wife that. Like, I love hearing these compliments, tell her to say more to me. But they said, Jared, you're exactly what we had. You're exactly what we need. You're exactly what I want to have going forward for my family, for my kids. And I said, wow, I'm flattered. Thank you. But, like I said, I'm a pediatric ER doctor. I work in the hospital. And they said, Jared, no, you're going to be with us. It took another couple families, so another 2, so starting out at 5 families to basically say the same thing time and time again. And it got me thinking. I spoke to my wife about it. I spoke to a lot of my mentors and advisors, from the places that I trained up north. And they said, Jared, this is your chance. Like, do it. Like, take the risk, take the plunge. And so what did I do? What I did was I actually started backing off on the number of shifts I had in the ER, and I started picking up concierge. And so in the ER, I still do shifts there, right? So I still do a small number of shifts monthly. And that's because I'm excited about it, right? That's what I went into to begin with. I try to stay up to date on the literature, the procedural skills. I'm also one of the core clinical faculty for the med students, the residents, and also the attending. So I teach in 3 medical schools as well. But it also gives me the opportunity to have and form relationships and connections, not only with the ER and the subspecialties and doctors I'm at, but I helped build a global network, those around the country and around the world and different cities that we can, bounce ideas back and forth. But more importantly, hey, one of my families is coming to you. Can you help me? Or vice versa. Families come down to Florida. So I built that. And basically during COVID, 2020, 2021, 2022 is when the term concierge really exploded. If you were not a medical professional or did not have a medical professional in your family or as serving as your liaison during COVID, unfortunately, you did not get the best care. I'm saying that as a doctor. I'm saying that as a parent. I'm saying that as a son. I mean, I knew it looking back. It just wasn't the case. Unfortunately, we're all learning as a world, as a community, a medical community. And so people decided afterwards to say, hey, how can we make this concierge? What can we do? So doctors started, charging a specific annual fee for access, and access meaning your cell phone number, access meaning, same day appointments in their office, access meaning, unlimited time spent with them to go over all of their needs, and access meaning, hey, if you need help, I can call one of my buddies, but you're on your own. And so concierge became big then, but it really took one step further a few years later. I'd say about maybe 3-4 years ago. And what that is really what I started doing. And I said, instead of families coming to me in my office, right? Because I don't have a brick and mortar office. I don't have an outpatient center or clinic. I said, why don't I bring that concierge care to the families? And these high net worth, high profile families that moved down here during COVID said, great, we have the money and we value this care. I want you to come to us. So I started, coming to my families, whether it's in their apartment, their house, in their private yachts, their private jets, in their hotel rooms, wherever you want. I would do text and calls and WhatsApp and FaceTime, telemedicine, but I also came to their home and provided real home services. So imagine someone coming to your home and performing a laceration repair with stitches. Imagine someone coming to your home after falling and getting splinted, and then, having them follow up with orthopedics with you arranged for the next day instead of waiting, 3 months for an appointment. Imagine having someone come and doing blood work or getting x-rays or ultrasounds in your home. Imagine, someone in respiratory distress has an asthma exacerbation and me coming to your home and providing that ER care in your home. So having the pediatric ER come to you instead of you come to them. That's what I started doing. That's what people started valuing. That's what people started paying for. And, I'm lucky to do it. I'm honored to do it. And it's interesting because a lot of people say, Jared, 2 questions. Number one, how can the regular population afford you? And I said, look, it's only a specific number of families, very niche, very limited for the families. But the stuff that I do on the side that we discussed earlier, Lauren, regarding, charity work, regarding health missions, all these things I do pro bono. And also whatever my families decide to pay, I give a 10% amount of that amount of money to a charity of the family's choice as a way of paying it forward. And not only that, but my families are not just my clients. They're truly my families. They're part of my own family. Their kids become an extension of my own 3 kids. I've been at birthday parties as a guest and also as a doctor. I've traveled on vacations with some kids. I've been at birthday parties, like I mentioned, family reunions, you name it. So it's really opened the door for what concierge is. And again, it really spread from COVID and, concierge, and then there's concierge. And there's different levels of that. So I'm just, again, very fortunate and lucky to be in this space, to have the connections that I have, with the training that I have and the expertise. And at the end of the day, I'm not by myself. We're not an island to ourselves. We are a team. The families, the parents know their kids better than any doctor out there, no matter what pedigree you have. So, we are a team, and I really believe in that openness and communication and that reassessment, in that providing that high quality care. And that's really why I did concierge and why my model is a little bit different than any other model out there. There's pediatric concierge, and then there's me. There's only one other person that I know that does pediatric emergency medicine concierge. But they're in the West Coast. So, and it's a buddy of mine. So we always have good relationships as well. But it's really an opportunity. So I'm fortunate and I'm very grateful.
Thunderstorms that are hanging out mostly off the
As a
coast
meteorologist, I
this
can't
morning.
always control the weather. And as parents, we can't always control our kids. But we can make sure our outfits aren't a total disaster. That's why I'm excited to partner with Mario Pucci, South Florida's destination for timeless, stylish clothing that fits every chapter of life. They can get you out of the leggings and out of the house. Whether you're headed into the office, out to dinner, or to the carpool pickup line, Mario Pucci has you covered. Plus, when you look great, parenting somehow feels easier. Visit Mario Pucci in Regency Park, Boca Raton today.
That's awesome. So, like 3 a.m., something happens, you're asleep, someone's calling you, you're out the door, going to their jet to like help them. You know what I mean? Like, what are some of the, you don't have to give specifics, but like people are calling you at all hours of the night if they need, and you're spending a day on a yacht because of something happening.
I know, poor me. No kidding.
Right?
No, the reality is this, before I started doing concierge, I became online medical director for a local community 911.
Mhm.
So I always make myself available in that respect. I also do volunteer in-flight physician, where, medevacs in other cities or even other countries. So we talk about traveling. I've traveled to other countries, whether it's, the Bahamas or Jamaica or Grand Cayman Islands, a lot in the Caribbean because we're obviously close there. But I basically I make myself available. I feel that some people are very possessive, and of their cell phone number. And I say, look, if I can save someone, if I can help someone, in Judaism they say you save a life, you save a world.
Mhm.
We're all our own worlds to each other and excuse me, and to our family. So we're all worlds to that. So if you save a life, you save a world. But getting into your question, if someone calls me at 3 a.m., like, am I going to pick up? Yeah, I will, because it means it's an emergency. It doesn't necessarily mean it's an emergency to me, because of my training. But if I can help, talk you off the ledge, if I can help say, hey, look, because of my training, I know you're concerned. We got this. We're going to do this together. Here's what I recommend. Here are the things to look out for. This is why I'm not concerned. That's what I'm going to do. And if it means that I'm going to lack sleep, it's okay, because it's really making a difference in other people's lives. So I try. I also only sleep 4 hours a night. So that's just me. I've done that since college and pulling all-nighters to study. Much to my health's dismay, because I need to work out more. I need to eat healthy. We all do. But I think sleep was a gift that I've got, that I can, function on limited sleep. So look, I'm happy to give my cell phone number. I'm happy to take these calls, whether it's here, whether it's my family, or whether it's, my concierge families, or whether it's some random person. And again, if I can help, I can save a life, I save a world.
That's amazing. A couple more questions just to sort of wrap up here. So obviously, like you mentioned, you are a concierge doctor. There are, I'm sure, numerous families listening where that's depending on who it is that they're looking for. It's very expensive a lot of times to have the phone number to a doctor, or if you're doing, on-call medicine or things like that. So for families that are going to a regular pediatrician, what are the types of things that they should look for when they're choosing a pediatrician? You mentioned down here the top 2 questions you asked were, who's a good OB, who's a good doctor. So if there's people moving here or wherever they're listening to this, they're a new parent and they're trying to find a pediatrician, what are things that they should look for, types of questions they should ask, so that they can make sure that they feel comfortable when they're going to that office?
Yeah, it's a great question. And I really feel that you have to find your match. You have to find your significant other. It's like finding a spouse. I know it sounds silly. I know it sounds burdensome, but it's so true. A pediatrician is basically an extension of you, an extension of your kids, is really the person that's going to be there for you when there's an emergency, be there for you when there's just a routine care, and be that person that helps and guides you. For someone who's a lay person, not medical, it is the number one, in my opinion, the number one most important thing. So what are you looking for? Someone you can connect to, someone that's open, someone that's honest, is so important, because at the end of the day, you're going to go back and forth. Hey, is this needed? Is this not needed? Should I do this test? Do I need to go to the ER? What should I do in the meantime? Having someone that, is communicative and really, provides you with that comfort level that you trust them. I think that's a big thing, because I feel like a lot of pediatricians are now giving parents what they ask for, what they want, even if it's not medically necessary, which is extremely frustrating. Just to give you one example, with ear infections, medically speaking, ear infections are the most diagnosed and yet over treated diagnosis in medicine today, in anything. And the reality is 88 to 90, edit that out. 88 to 92% of ear infections are not bacterial, meaning they do not need antibiotics. And I'll take it one step further. when someone says, oh, it's just a virus, a parent is saying, oh my God, I literally just took time off work. You're home from school, you're sick, and I'm coming to you for medical judgment, for medical guidance, for medical opinion. And you're telling me it's just a virus and you're not doing anything about it. You're not doing any tests. You're not doing any, giving any antibiotics. You're not, doing anything. You're just telling me it's a virus. It has to do with communication. It has to do with that shared decision-making model. It has to do with explanations. And today in medicine, find that pediatrician that will give you the time of day, that will sit down with that for that extra minute or 2 minutes or 10 minutes and just say, hey, look, we got it. This is what's going on. Here's why I think that way. I'm not perfect, but from my experience, we're in this together. And let me know if anything changes and provide that anticipatory guidance. What is going to happen or what will or potentially can happen to look forward to, or things that will change. And we'll get through this together. So again, just in summary, finding someone you can trust medically, finding someone that you can communicate with, and finding someone you get along with. Because at the end of the day, this is your prized possessions, and that's really priceless.
That's really good advice. I have two more questions for you. So your episode is going to be airing it will come out in the morning, but the last day essentially of Passover. So I find it very fitting that we're talking at like just the right time. What are you hoping to, I'm going to ask this sort of present tense, but also past tense, because obviously we record these a little in advance. What are you hoping to have gotten out of this week of Passover? Or people that are listening, whether they are Jewish or not, what are you hoping, is a good reflection to kind of look back on for this week?
Yeah. So Passover to me and any other holiday, and again, you can say a Jewish holiday, a non-Jewish holiday, it doesn't matter. What holidays are a time for family. It's a time for togetherness. It's a time for unity. It's a time to just be one. Make memories, make experiences, going into my whole diatribe from earlier. So one of the things that I would have hoped to accomplish is exactly that. Spend quality time, not quantity. Well, I mean, quality, fine, quantity, fine, but quality time with my kids, with my cousins, with my sister, my parents, we're all getting together because Passover is a big thing. And just the other thing, which is really important to me, and for those who are not Jewish, Passover is about, coming out of slavery, coming out of, Egypt and building the pyramids and really forming a new people, a new beginning. And one thing that I just try to extrapolate for that, well, again, whether you're Jewish or whether you're not, it doesn't matter, is that each of us is carrying around our own bondage, our own personal slaveries. So my wish and my hope, when this airs in this next 8 days or so, is that, we realize what that is and how we can slowly overcome our own insecurities, our own weaknesses, our own personal slavery and bondage.
That's great. And then I always like to end each episode with a more fun question. So we're going to each share our high and low for the week in parenting. Some people call it just that, a high and low, a rose and a thorn. On the Weathering Parenthood podcast, obviously we stick to the theme of weather. We call it the sun and the storm. So a happy sunshiny moment and a maybe not so great one, stormy moment. I'll start so that you can kind of get an idea of what it is we're sharing. The sun is that I just started a new work schedule. So you were saying you sleep 4 hours a night. I used to come to work at 3 a.m. My alarm would go around 2. And so, yes, very crazy, weird early hours. I've been doing that for about 12 years. So the sun is that I don't have to do that anymore. I now get to come to work at 10 a.m. I get to spend time in the morning with my kids, which normally it would just be my husband because I would already be here. So it's been really nice to like wake up in the morning to the sound of like my toddler singing in his bed before I like go and get him in the morning. And it's great to like actually sleep a little bit more. The storm of it all is that I still have absolutely no idea like what time it is, or like it's weird that I go to work now and there's cars on the road and the sun is out and I'm used to being like the only one on the road in the middle of the night. So sort of kind of figuring out like the kinks with now having like what I call a normal people's schedule.
Love it.
Right. But those are my two highs, my high and low for the week. So now it's your turn to share.
All right. So I'm going to start out with my low. I'm home, as you can say. I'm not in your, in your
studio today.
studio today. So my little one, who's 2, is actually home with me. And the only way I could have him be somewhat quiet is by turning on the TV and giving him a lollipop. Yes, I'm watching him with a lollipop, but that what I would say, as a pediatric ER doctor, that's probably one of my lows. So don't judge me. I'm still human. And my high is whenever we go out, my kids love to go on scooters, and they see their friends all over the place riding scooters without helmets. And they know before they go out, they're like, okay, get your scooter, let's go, and safety. So whether it's in a car seat and buckling up, or being in a booster of the right age in the car, whether it's wearing a helmet, whether it's putting on sunscreen, I'm not strict, but I'm very observant of what my kids, try to do. And, that high, take it one step further, is about role modeling. I will also wear a helmet. I will also put on sunscreen. I will also, click my seatbelt. So again, though in life, it's not saying things, it's doing things. So show people, don't tell people.
I love that. Jared, this was so great, except for your cell phone number. I'm going to put, your website and information so that people are able to connect with you if they would like to reach out. But we really appreciate you being here today. So thanks for taking the time. Thank you all at home for listening and watching, and we will see you all next week.